Contraception, also known as birth control, is the use of artificial methods or other techniques to prevent pregnancy. Female contraceptives can be categorized into 5 main types. These include mechanical barriers, hormonal contraceptives, intrauterine devices, commonly known as IUDs, female sterilization, and emergency contraception. Mechanical barriers include female condom, diaphragm, and the cervical cap. Female condom prevents pregnancy by acting as a barrier to the passage of semen into the vagina. However, it is important to note that simultaneous use of both female and male condom is not recommended because they may adhere to each other, leading to displacement of either device. Diaphragm prevents pregnancy by acting as a barrier to the passage of semen into the cervix. Once in position, the diaphragm provides effective contraception for 6 hours. Cervical cap acts as a mechanical barrier for sperm migration into the cervical canal. Hormonal contraceptives prevent pregnancy through various mechanisms. Hormonal implants, contraceptive injections, oral contraceptive pills, and contraceptive patches belong to this group. Hormonal implants consist of one non-biodegradable rod of 40% ethylene vinyl acetate and 60% etinogestrel. It prevents pregnancy by suppression of ovulation, thickening of the cervical mucus, which in turn prevents the penetration of sperm, and by prevention of endometrial growth and development. Contraceptive injections are composed of the hormone progestin. Depo-Provera is a well-known brand name for contraceptive injections. These injections work by inhibition of ovulation, thickening the cervical mucosa, and by preventing implantation. Oral contraceptive pills contain artificial versions of the female hormones estrogen and progesterone. The main mechanism of action of these pills is to suppress ovulation. Contraceptive patches release estrogen and progesterone directly into the skin and then into the bloodstream and prevent ovulation. An IUD is a small T-shaped plastic and copper device that is inserted to the uterus by a healthcare professional. It protects you from getting pregnant for 5 to 10 years. It alters the cervical mucus, which makes it more difficult for a sperm to reach the egg. It also prevents the implantation of a fertilized egg. Female sterilization is a permanent surgical option to prevent pregnancy. During this surgery, the fallopian tubes are blocked or sealed to prevent the eggs reaching the sperm and becoming fertilized. Emergency contraception is the use of a drug or device to prevent pregnancy after an unprotected sexual intercourse. There are 2 methods of emergency contraception: the copper intrauterine device, which is the most effective one, and the emergency contraceptive pills. The intrauterine device must be fitted by a healthcare professional within 5 days of having unprotected sexual intercourse.